Hello, my name is Stephanie Hoeft, and I will be presenting depression screening in primary care settings. This presentation is for my trip assignment, so let's get started. In general, there is a concern about depression being underdiagnosed and undertreated in the primary care setting. This has led to support for routine I've messed that word up on every take, so I apologize. Screening. So routine screening for depression in the primary care clinic because we are concerned about underdiagnosis and undertreatment. This particular study that I am using for this is a research on information that is already out there. But in this research, I have some major points that are included in this study. So existing data from completed randomized team trial of collaborative care depression treatment. So like I said, it's existing data, but it's randomized and collaborative. The sample analyzed in this study consisted of general internal medicine clinic patients who were screened for depression. And then if they screened positive, which is my next bullet point, they were referred to the study. So it's just randomized patients in this particular clinic who were referred to this study. Patients had to meet DSM-4. So we're currently on DSM-5. However, you'll see in my next bullet point, this analysis was conducted between January of 1998 and July of 2003. So at that time, they were using the DSM-4. DSM-4-TR was not out yet, and DSM-5 just recently came out. So they used DSM-4 criteria, and the patients needed to meet the criteria for major depressive disorder, dysthymic disorder, which is minor depression, or both of those. And in this study, they used 3 major screening options that were analyzed. Those are a 2-stage waiting room screening tool. So this is when a patient is handed a depression screening tool, fills it out in the waiting room, and hands it back into the receptionist. From there, it gets analyzed, and then if they screen positive, someone will reach out to them. Second is a 2-stage screening tool used in clinic. So this is where patients, again, in the clinic, fill out a screening tool, but it is actually brought into the room with the provider. The last one is a 2-stage screening used in send-out mailing. So it's kind of like the survey you get, how is your care? So they send out a depression screening survey. And that is for people who visited the clinic. So just to kind of put this in perspective, the importance of depression screening during medical care. So medical care, whether in a clinic, outpatient, or the ER, can be the patient's first opportunity to express depression, symptoms, and feelings. Patients will go years and decades without ever telling anybody about their feelings of depression. However, if discussed in a medical clinic, there's potential for the symptoms to be brought to light. Mental health care is just as important as medical care. That's something very important to remember. Patients often do not know where to turn for mental health care. So patients know that obviously when they have a cold, they broke their foot, they have something physical going on, you go to a medical doctor. However, they may not know for mental health that you can also go to the doctor. They might not know about psychiatrists or counseling and think that the medical care provider is just for medical symptoms. Patients are less likely to seek mental health care than medical care. As mentioned before, patients don't necessarily know where to turn for mental health treatment and feel that they don't know where to go. Patients experience medical issues as somatic symptoms of depression. So patients can have, trouble sleeping, stomach aches, constipation. So many different physical symptoms are part of depression. So when they do go into the doctor for their physical symptoms, that is something where they can be screened to see if they have depression, which would then help clear up their physical symptoms. So which of those 3 screening tools do you believe was the most efficient in this study? I will give you a little reminder of the 3. So the first one was the 2-stage waiting room screening tool. The second was a 2-stage screening tool used in the clinic where it actually went to the provider. And then a 2-stage screening used in send-out mailing. If you guessed 2-stage depression screen in the clinic, you're correct. That is the most effective way to screen for depression. Again, this is why I am presenting this, because that depression screen in the clinic also involves nurses, just as well as doctors. Nurses in the clinic, when they are in contact with that patient for whatever they may be there for, it is important to also ask some depression screening questions so that can be identified as well as their physical issues. And like I stated before, some of their physical issues could be due to depression as well. So the waiting room appeared to be less effective in this study. In this study showed that only 12 to 21% were identified and treated through this in a timely manner and effectively. These were moderate in speed, as they were collected by the receptionist, but then someone still had to go over them, analyze them, and then reach out to the patient. And the mail-out form was rarely returned by patients. Only 6 to 10% were returned and effectively treated. So this was a very slow process for patients to receive treatment if needed. They had to complete the screening, mail it back to the facility, then it had to be opened, analyzed, and then someone would reach out to them. So as you can see, those are not very effective in getting the correct treatment right away for patients, and it can be lost in communication. So the clinic screening was most effective. Again, that's it. 1 year in the clinic, you're actually face-to-face with the nurse, you're face-to-face with the doctor. This came in at about 27 to 48%, identified patients with depression and treated. This was a relatively fast way to screen for depression because the nurse and the doctor were able to collaborate to refer the patient out. Again, nurses, you are kind of that first line. So if you screen the patient, you can also provide this information to the doctor. Hey, I believe this patient is at risk for depression. please see if you can refer them out. These are my references for this presentation. If you have any questions, feel free to reach out. And again, I like to always emphasize mental health is just as important as physical health. And as nurses, we are there. We are that first line of defense. We need to help the mental health, such as depression, as much as we need to help the physical issues they're coming in for. Thank you. I hope you enjoyed this presentation.